Hey, this is K Puckett, and I'm going to do my head-to-toe assessment on my dad. This is Philip. He is 53-year-old male, Caucasian male. He's alert and oriented ×3. He's dressed appropriately for our head-to-toe assessment. Vital signs are within normal range. He is 6'2", 305 with a BMI of 40. His skin looks normal color. He has a scar in the midline chest from a previous surgery. Texture is soft and moist, and turgor is good. He has no tattoos or piercings. His head is normocephalic. Facial features are symmetric, and he is in overall good health. I'm going to do his peripheral vascular assessment. So I'm just going to check both of your radial pulses. They are a +2. I'm also going to palpate the dorsalis pedis pulses, and they're also a +2. His neck is symmetric. Trachea is in midline. I'm going to do his lymph nodes now. So we've got the pre-auricular, the post-auricular, the posterior clavicle, or the posterior cervical, anterior cervical, and subclavicular. He has no swallowing problems. Going to palpate his thyroid now. So I'm going to have you tilt your head down just a bit. Thyroid's palpable, no enlargement, and no tenderness. Eyes, his lids are open and closed symmetrically. The sclera is clear, and the conjunctiva is green. His ears are well formed. They sit at the level of the ears. There's no tenderness and no drainage. His nose is also symmetrical and patent. There's no septum deviation noted. Okay, so mouth, if you'll open your mouth for me. Mouth is pink and moist. Can you say ah? Ah, as you feel it goes up and down. His teeth are in good dentition. No appliances in there. He still has his tonsils, so they're visible. Gonna listen to his chest now. His respirations are unlabored. They're equal and they're clear. So we'll start with the anterior. We make an H. And if you'll just sit up for me. We do the same on the posterior. And you also want to make sure to listen to the right middle lobe. He's clear, non-adventitious breath sounds, and his chest is normal shaped. And our dog has now joined the video. So he has no barrel-shaped chest and has no respiratory distress. For cardiovascular, we listen to the apical for 1 minute, and then we also listen to the point of maximum impulse, which is at the apex, and I would have him lay down, but for now I'm just going to listen to the 5 points. So the first point is the aortic. It's on the right side, second intercostal space. Then you go over to the pulmonic, and it's at the left second intercostal space. Erb's point. Tricuspid. natural. And his belly's growling. So GI-wise, he has a round, non-distended, non-tender stomach. I'm just gonna have you lean back, okay? So watch out, everyone. So belly-wise, he's not having any tenderness, no scarring there. He has vowel sounds in all 4 quadrants. I would say that they are a little hyperactive. He's doing a prep for a colonoscopy tomorrow, so that's fun. So palpating the liver, non-tender there. Awesome. Okay. So now I'm going to do CVA tenderness on the back. So if you'll just sit up for me, Dad. Good. Jesse. And you just palpate on both sides.
Sit.
No tenderness there, Dad, right? Okay. If you will stand up for me. The alignment of the spine is straight. There is no scoliosis, kyphosis, lordosis, no issues there. No masses. If you'll just kind of bend at the waist, there are no masses and no tenderness. Okay, Dad, you can have a seat. You want to go sit over there? Okay, good. So now we're just going to do range of motion. So range of motion, he can total range of motion on the wrist, in the arms, same with the legs, and then if you can just bend your ankles. Perfect. Awesome. I'm going to have him do hand grips and foot pushes. So squeeze my hands, don't hurt me, but squeeze them good. Okay. +5, he's got great hand strength. And then foot pushes, just push down like a car pedal. Perfect. Great. So now we'll do the cranial nerves. We'll start with olfactory. Jesse. Start with olfactory. Have you had any changes in smell? No? Okay, great. And then optic, I would have him read fine print of some sort. He has had cataract surgery in one eye, but he's able to read just fine with reading glasses. Oculomotor, we'll use our pen light. We're going to come in. I'm going to shine a bright light in your eyes. Awesome. He has pupils are reactive, equal, round, and they accommodate to light. And then I'm also going to do the 6 cardinal fields for the trochlear and abducens, the 4 and 6 cranial nerves. So I'm going to have you look, just follow with your eyes. You're going to look here, 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 here. Great. Do the 5th cranial nerve, which is the sharp and soft touch. Maybe, if I can find my stuff. Well, here's the sharp. Yeah, here it is. So, that, if you'll just close your eyes, I just need you to tell me if this is sharp or soft and what side, okay?
Sharp, right side.
Good.
Soft, left side.
Great. We are going to do test cranial nerve 7. And so I'm going to have you smile really big, puff out your cheeks, look surprised. Good. Good job. The acoustic cranial nerve 8, we would do a whisper test. So I would stand at the right side, whisper, and he would read back to me what I whisper. The 9th cranial nerve, we would ask about taste, changes in taste or changes in reflex or swallowing. He has reported none of those. The vagus nerve, which is 10, we can do the uvula, which is, you can watch it go up and down. Say, ah.
Ah.
Awesome. And that means that that nerve's intact. That's both equal and bilateral. And there's no hoarseness, no aphasia. The 11th cranial nerve, we will do the shoulder shrug. So he will just kind of take your shoulders, good, and go down. And one more time, good, great. And then we can also test that by doing the facial. So you'll just push your face against my hand. No, there we go, perfect. And then next, great. The 12th cranial nerve, he's just gonna stick out his tongue, make sure it's midline, make sure he can go left to right. So stick out your tongue straight, straight, left to right. Good, perfect, good deal. So the sensory will do the sharp, and we already did the upper and lower, so that's done with the sensory. And then the cerebellar, to test that, we will do so Dad, you're gonna take your hands like this, and then you're gonna flip them back and forth like that on your legs. Perfect. And then you're also going to, you're gonna take your finger, touch your finger to my finger, and then touch your nose. Do it a few times. Fast. Fast. Good. Okay. Can you take your heel and go down the opposite shin? Awesome. And the other way. Great. And then for the Romberg test, if you'll stand up for me. And you are going to close your eyes. And you are going to take your arms out and walk towards me. Good. Jesse. And then pronator drift, we will just take your arm, if you can open your eyes now, and then just stick your arms straight out for me, and don't let them fall, okay? Perfect. If you can just take a few steps this way, and then if you can turn around, we'll check the tandem gait. You walk heel to toe. Heel to toe. Good. And that concludes my video of my head to toe assessment. Thank you.